Cool. So yeah, thanks for being here, Jay. Definitely. It's always good to talk to someone who's in a field of industry where everyone needs it. Doesn't matter where you're at, where in life. It's definitely one of those like kind of basic needs. But yeah, like I work obviously like with recruiting for nurses and healthcare, and even before that, I worked with multitude of companies, and everyone always asks the question of, is there health insurance? Types of plans, costs, those things. And so, if you could just tell me a little bit more about like yourself, how you got into the industry you're in, and then yeah, I'll go over a couple specific questions I have regarding insurance.
Thanks, man. Well, thanks for having me. Yeah, so I got into this actually well, first of all, my name is Jay Reagan. I provide health insurance solutions for individuals, families, and small businesses. So it's not a one size fits all. It's always an individual conversation. But I got into this actually my childhood best friend has been doing this for about 4 or 5 years, and actually sold me a plan, and it worked out really well. And I've seen every aspect of the insurance industry. Now I'm on this side of it, and it's a mess. It really is. I mean, it's confusing. It's difficult to understand. And I've been there. I've been on Medicaid. My wife was pregnant, and we lost our insurance. Had to go through that. I've had Cadillac plans that were $1,600 a month that covered anything and everything and paid zero. And that was how I actually got this job. Is my buddy's like, man, you got to check this private insurance out. And I eventually signed up for it, and it was great. It was a zero deductible private plan. And I actually 13 weeks ago today, I had heart surgery on it. So I'm very familiar with the entire process inside and out from a patient, as well as somebody that's selling this type of solution as well. So I've had shoulder surgery. This is several years ago, but I'm very familiar with the process, and I can empathize with individuals who don't have insurance or are in this weird gray area that they make too much to be on Medicaid, but don't make enough to get on an employer plan or work enough hours. So generally speaking, employer-based coverage, we live in our American system is an employer-based system. So what that means is that 95% of the time, if you have an employer-based plan, that's going to be your best fit. But like I said, mine was too expensive, and I saved about $1,000 a month by switching to a private plan, which I can actually take with me. So when I left that company, I just kept the plan with me. So it goes from job to job. It's perfect for nursing recruiters, nursing travel nurses, because they can get insurance. It works in all 50 states. I can write plans that will cover you in all 50 states for pretty much any doctor, any hospital. So it's incredibly powerful in that respect. Truck drivers, anybody that travels a lot, if you're young and relatively healthy. When I say young, I mean I'm almost 50 now. But
That's
I
still young.
mean, maybe 30, a 27-year-old professional that has a family. This is ideal. Some of the private insurance. So I mentioned the employer-based insurance. That's usually the best bet because number one, the CEO is going to be on it, and number two, they're usually going to subsidize it. Beyond that, you can get into the marketplace. That is an option. Those are usually best for individuals. If I talk to somebody who says I need knee surgery next month, then that's usually going to be a marketplace plan because they cannot disqualify you for pre-existing conditions. Same with employer-based coverage. Private networks just work a little differently. They're usually better plans, but they do disqualify for pre-existing conditions. And that's where the one size fits all scenario, doesn't apply again, because each individual, each family member has different issues, or, the son or daughter has a medical issue. So sometimes you can put entire families on different types of plans. I've actually done that with mine. So my wife is on one particular plan, and my son and I are on a different plan. So it really depends on each individual situation.
Now, with
Yeah.
just to kind of I build off of that. So obviously there's a variety of different types of plan. Pre-existing conditions obviously take effect into that. And I know you mentioned about pay as well too. Are there certain things to where people get disqualified for? Are there things that, make, I mean, obviously young age and relatively healthy is like the ideal candidate, but like are there things where that people should look out for that or try to avoid as far as like being disqualified from getting insurance?
Yeah, so it's not, I mean, stay away from as far as conditions or.
Yeah, or I mean, I guess stay away probably isn't like the best way to put it, but are there things that disqualify people from getting insurance in the first place, like certain conditions? Are there anything like that?
Yes, and that's where the case by case basis comes in. So
Okay.
that's what I do. So when I talk to an individual, it's usually one person at first, because the one person in the family is usually searching for something, for the entire family. And what we'll do is a an assessment of the situation. So it really depends on what they're prescribed, what medications they're taking, the last time they were hospitalized, when if there was a procedure, when was the procedure, and a lot of these underwritten private plans have settings on or kind of rules on what you can do and not do. But that's kind of where, and we were kind of talking about that a little bit earlier, where the personalized situation comes in, where you get to know the individual, and you kind of explain how this all works, and they gain your trust because I've been there myself in any type of situation that they can describe, and assess the situation and then make recommendations based upon what I know. So whether I have associates, basically I can write any, or I can review any plan in the state. So it really depends on the individual and the family and each situation. I can review any plan in the state and write specific plans, but I'm always able to find families or individuals insurance, whether it be me or with a marketplace. I can help with a marketplace or other plans that I don't even write. I'm always going to find the right solution for the individual. Or if it's going to the state and finding Medicaid, if that happens a lot, they don't make enough, and they can qualify for Medicaid and they can get on that. So yeah.
Nice. So I know you said that one of your best friends helped you as far as like getting coverage and plan. Did he help you get into the industry as well too, as far as like getting you hired on?
Yeah, so I'm an independent contractor, and we work together. I talk to him all the time, every day, and he's basically my mentor in this whole process, which has been a lot of fun, just in general. But I mean, he's been in it for 5 years. Our team leader has been doing it for 20 years or so. So it's really fulfilling. I really enjoy helping people, and it's not a sales job to me. It's a solutions job. I love listening to each individual's needs and wants and budgets, and finding them the perfect fit based upon what they tell me and talk to me about. And it's not just a number. They're not a number. They're not a sale. It's a whole process. I really enjoy it. It's very fulfilling because it's quite confusing. I've been there, as I mentioned. So it's overwhelming and it's broken. And until we fix it, I'll continue to do what I do. I really enjoy doing it. So.
Nice. So I know you mentioned that you're an independent contractor as well too. So what is the difference between someone like yourself who individually contracts, who individually creates these plans, and Obamacare that's supposed to be like a, blanket for anyone and everyone who
Sure.
doesn't have insurance?
Yeah, so the Obamacare or the marketplace or the ACA, it's all the same thing.
Okay.
What it essentially is a website and a subsidy. I mean, simply put, I mean it's
Okay.
much more than that. There's some rules, like it allowed people to or kids, 26-year-olds to or children to stay on until 26. That was something that changed. You can't decline somebody for pre-existing conditions on the marketplace. And before that, you could. So pregnancy was a pre-existing condition. So you couldn't get coverage, which is crazy to think about. But so that's changed a little bit, and that's been great as of 2010 when that did pass, just as an option for some individuals. It's not the best fit for a lot of people because sometimes the deductibles can be high. But for some individuals, that's a good fit. So the difference between that and some of the private insurance, the private insurance doesn't have to follow the ACA rules laid out by the government. So, all the ACA plans have to have certain things in them, and they have to have certain types of coverage. The private plans, there's no open enrollment. You can get on and off anytime. Like I can put somebody on a private plan, cancel at any time, and they'll even prorate the month for you. So if you ever get insurance with a group employer, I stay with individuals for the life of the plan, right? So I don't go anywhere. So whenever I work with somebody, find them a solution, I'm constantly, helping them find, better prescription medication or doctors or hospitals, or I work with prescription specialists that can
So if
find
their conditions change, you can help them adapt to it.
Yes, exactly. So, somebody gets pregnant, then we cross that bridge when we come to it. So, I stay with the individuals for the life of the plan, which is also fulfilling because you get to know the individuals and the families. And I did a small business this past week. It was a pest control company out of like Oxford, Mississippi. And there's like 9 different people. So small businesses you can do as well. I just do each individually. And if the employees ever leave the company, they can just take the insurance with them. And the group coverage was just getting too expensive for the owner. And it just like doubled in price with the premiums and the deductibles. And this was just such a much better fit because it just seems to be going up and up as far as the pricing. So private insurance is great if you can, if you're a fit for it. It depends on the
Yeah. It's crazy how insurance has gone up. I was just talking to my dad, and he was like, "Yeah, back in the '90s, when I had like you and your other siblings, he was like, he had a flat rate where he paid who knows like $200 a month or $300 a month for a family of now 5. He's like, I didn't have to pay anything for your births, but now times have changed because it's how much insurance was going to cost not only monthly but for the actual birth as well too." And he was just like, that's crazy. But that's how the times have changed.
It's changing. Yeah. I mean, like my father's generation, we're similar age, but he was with the same company for 35 years. So it's not something that they really thought about much. And I talk to people. I've been with the job for 40 years, talk to individuals, and I didn't even know this was a thing. Going into that world of where you don't have employer insurance anymore, if they're just about to retire and they're only 60, they've got 5 years, they need gap coverage. They don't even know where to start, and there's no guide, so it's a different generation, it's a different time, and these private, so a lot of these private insurance options are a really good fit for certain individuals. So I love doing it.
That's crazy, but that's good though as well too. Good that you are able to help people, and you've definitely helped some of the people that I know, and been helped me with more information as well too. So it's very beneficial. I believe everyone should get in contact with you. So if people do want to get in contact with you, whether they're just curious and want to inquire about pricing, or just to know like what's the best plan, whether the plan they have is good for them, what's the best way to contact you?
I'll put my website on the bottom and yours on the top here, but ReaganHealthSolutions.com, or they can reach out via cell, text me 312-286-4195. But I'll put all the information and the link in here so we can get people, good coverage. And not only that, just good advice on what
health
to do.
Is wealth.
Explanation.
Yeah, health is wealth, most definitely. I've definitely focused on that this past year. So yeah, definitely. Hopefully, people take advantage of you, your wealth of knowledge as well too, and see if they can, get some coverage.